There are 7 characteristics that if chest pain has them, we can say with absolute certainty that the cause of the pain is not the heart. Almost everyone knows that the most important sign of a heart attack and blocked heart arteries is chest pain. But as we know, aside from heart attacks, there are other causes that can also lead to chest pain. Because in the chest, besides the heart, we have other organs as well, such as the lungs, digestive system, respiratory system, muscular system, and bones. And each of these can be a source of pain. Now, the question that arises here is whether we can determine, based on the symptoms and the type of pain, if this pain has a cardiac origin or a non-cardiac origin. There are certain characteristics that if chest pain has them, we can say with absolute certainty that this pain is not of cardiac origin, or at least it is not due to a heart attack or coronary artery blockage. A pain that is felt as sharp and stabbing. That is, the patient describes it by saying, "My pain feels like someone is stabbing my heart with a knife or poking it with a skewer." These pains that are so sharp and stabbing and moreover get worse with breathing, coughing, or sneezing. These are usually not due to coronary artery blockage or a heart attack. And usually the cause is inflammation of the membrane around the heart, or the membrane around the lungs, as we call it. Pericarditis or pleuritis, which occur following respiratory or lung infections. Second, pain that is felt only in the abdominal area. Cardiac pain can radiate to other areas. For example, it may radiate to the lower jaw or even to the lower teeth. In many cases, it has been observed that the patient visited the dentist because of toothache. Upon examination, it turned out that the problem was not with the tooth, but with the heart. They had a heart attack, or it may radiate to the right shoulder or the left shoulder, or even spread to the stomach area and be mistaken for stomach pain. But if this pain is only in the abdomen and we don't feel it in the chest or anywhere else, it's unlikely that it is coming from the heart. There are also fingertip pains, meaning pains that the patient points to with the tip of their finger. They place the tip of their finger under their left breast, exactly over the tip of the heart, and say it hurts at this spot. These are the kinds of pains that we or the patient can point to with a fingertip. These are not heart-related pains and are not due to a heart attack. The characteristic of heart-related pains is that the patient indicates them with the palm of their hand or a clenched fist, placing it on their chest and saying, "This is where it hurts. It feels like my heart is about to burst. My heart is under pressure, and this is a sign of a heart attack." Fourth, pain that is constant and continuous. That is, the patient says, "I started having heart pain since this morning, and it's still there now. Its intensity hasn't decreased or increased." This pain does not have a cardiac origin. Why? Because the cause of heart pain is that blood doesn't reach the heart cells and the myocardial cells. But in someone who has had a heart attack, the reason for their pain is that enough blood doesn't reach the heart cells. Therefore, the cells die, and when the heart tissue and cells are destroyed, there are essentially no cells left to feel the pain. Usually, heart pains start within a few minutes, reach their peak, remain intense for an hour or two, and then begin to improve. Fifth, there are pains that last only seconds. Some patients say that within a second, a pain hit my heart, lasted a few seconds, and disappeared in a split second. And usually, this type of pain is not cardiac pain. As we mentioned, cardiac pains last at least several minutes and reach their peak. It may even stay at its peak for half an hour to an hour and then gradually decreases. Therefore, pains that last only seconds, those that appear and disappear in a fraction of a second, these usually do not have a cardiac origin and are not related to heart attacks. Sixth, there are pains that radiate to the legs. We said that cardiac pain can radiate. That is, it can shoot. Someone experiencing heart pain or a heart attack may feel the pain shoot to the lower jaw, or it may radiate to the upper abdomen, but it does not radiate to the legs. Therefore, if the pain radiates to the legs, its cause is something else. And seven, there are pains that worsen with changes in body position or by moving the arms and shoulders. This indicates that the cause of the pain is not the heart itself, but rather the muscles and musculoskeletal system outside the chest. And sometimes it may even be due to arthritis. These are musculoskeletal pains and are not caused by blocked heart vessels. Therefore, if the pain felt in the chest has these characteristics, we can confidently say that it is not due to a heart attack or blocked heart vessels.